Debridement and skin graft. The question is, a patient had a debridement and a skin graft in an acute setting. Now the patient is at a LTAC, so long-term acute care hospital. I have two different thoughts concerning what to code. A, aftercare following surgery of skin and subcutaneous tissue, and B, aftercare for organ transplant. Any thoughts on what to do? And I looked up the V code or the aftercare code for the surgery of the skin. To me, that's what this is. It isn't a prosthesis or anything like that. Let's see, what did it say here? Organ transplant. Yes, it's skin, and you can view it as a transplant, but because there is a code for skin, and it came out and said debridement and skin graft, that's the one I would go with. Okay, so I looked this one up, and it says V58.77, aftercare following surgery of the skin and subcutaneous tissue, not elsewhere classifiable. So to me, that would be your choice if you were going to code aftercare codes. But I wasn't completely convinced that we're ready to start using aftercare codes, because when I started to read this in the guidelines, aftercare visit codes cover situations when the initial treatment of a disease or injury has been performed and the patient requires continued care during the healing or recovery phase. So I'd like to see the documentation to determine whether or not the documentation's reading like they're in the healing or recovery phase. I suspect that they're still probably in the acute phase. And then it says the aftercare V code should not be used if treatment is directed toward a current acute disease or injury. Then you use the diagnosis code to be used in these cases. And the diagnosis code would be, the conditions classifiable to 680 to 709. So you'd look them up. Oh, how handy that link worked. I did not do that on purpose. So it could be one of these infections of the skin, if that's what it's for. Maybe it was an inflammatory condition or whatever. You would code that, as acute. It's not actually in the recovery phase yet. So based on the documentation, that's how I'd figure it out. It also goes on to say that the aftercare codes are generally first listed. We were talking about that on the other slide to explain the specific reason for the encounter. An aftercare code may be used as an additional code when some type of aftercare is provided in addition to the reason for admission and no diagnosis code is applicable. So hopefully that will help you with that scenario. But it did say they had a debridement and skin graft. They're now in a long-term acute care hospital. So I kind of, didn't get the sense that they were coming back on an outpatient basis for maybe, some aftercare for the fact that they had this graft.
Get more CPC exam tips, coding certification training, and CEU credits. Go to www.codingcertification.org.